In this video, we're going to review the benefits of breastfeeding for infants and mothers, recommendations for breastfeeding, signs of hunger and adequate feeding, breastfeeding techniques, steps, signs of a good latch, frequency and duration, breastfeeding positions, maternal nutritional recommendations, and common breast problems, treatment and prevention. What are the benefits for the baby? Breast milk provides many benefits to your baby and contains nutrients such as vitamins, minerals, protein, carbohydrates, and fat. It is much more easier digested than formula, and the nutrients are well absorbed. Breast milk also provides antibodies that can help your baby fight off viruses and bacteria. Babies who are exclusively breastfed for the first 6 months have fewer infections such as ear and respiratory, and so on. Breastfeeding lowers your baby's risk of having allergies, asthma, diabetes, obesity, some cancers, sudden infant death syndrome, and decreases the risk of infant mortality. What are the benefits for the mother? Breastfeeding also benefits the mother. It helps you lose the weight you gained during pregnancy. It also releases the hormone oxytocin, which helps your uterus contract and return to its normal size, which reduces bleeding. Frequent breastfeeding also delays ovulation, which protects you from becoming pregnant again too soon. It lowers your risk of certain cancers, including breast and ovarian. It enhances bonding and attachment with your baby. And finally, it saves time and money. What are the recommendations for breastfeeding? According to the American Academy of Pediatrics, you should exclusively breastfeed your baby for the first 6 months of life. Then, between 6 and 12 months of age, you can gradually introduce solid foods while continue breastfeeding. After 12 months of age, you can continue breastfeeding if you desire. Similarly, according to the World Health Organization, after 6 months of age, you should introduce solid foods while continue breastfeeding up to 2 years of age or beyond. What are the hunger signs? Some early hunger signs, or sucking movements, such as sucking on the hands or the blanket, lip smacking, hand-to-mouth movements, and in general increased activity and fuzziness. Crying is considered a late hunger sign. How to breastfeed correctly? Before you start, wash your hands and get into a comfortable position with great back support. Place your thumb on top of your breast and your other fingers below, creating either a C hold or V hold, just like the picture on the right. Be careful not to touch the areola. Use your nipple to touch the baby's lips until the mouth opens widely. While pointing your nipple upwards, put the nipple all the way in the baby's mouth and try to get as much as possible of the areola into the mouth. To remove the baby from the breast, insert your finger to the corner of the mouth between the gums. What are the signs of a good latch? The baby is latched on correctly when the tongue is seen when the bottom lip is pulled down. There is a circular movement of the jaw when the baby is sucking rather than a rapid chin movement. There are no clicking or smacking noises when the baby is sucking. Swallowing is heard. The baby's chin is touching the breast and the lips are flanged out, just as the picture shows. When the baby comes off the breast, the nipple is not flattened or misshaped, and any discomfort and pain ends up quickly. How often and how long should the baby be breastfed? Babies should be breastfed every 1.5 to 3 hours. In a 24-hour period, there should be 8 to 12 feedings. Breastfeed your baby for a minimum of 10 to 15 minutes on each side, or longer if the baby desires. Cluster feeding is when the baby nurses several times close together. It is absolutely normal, and it doesn't mean your milk supply is not enough. Finally, strict scheduling is not necessary. What are the breastfeeding positions? The first position we're going to talk about is called cradle hold. Support your baby with the arm on the same side as the nursing breast, while the baby's head rests in the crook of your elbow, just as the picture shows. The other hand is free to hold the nursing breast. Finally, use a pillow to support your arm. The next position is called cross cradle hold, and it is the opposite of the previous one. It is helpful for preterm babies and for those with a broken clavicle. Hold the baby's head and the hand opposite of the side on which the baby will feed and support the baby's body across the crook of your arm, just as the picture shows. The other hand will hold the breast. Football hold is a good position if you're recovering for a C-section or you have large breasts. Support the baby's head and your hand on the same side with the nursing breast, while the baby's body rests and pillow alongside your hip. Side-lying hold is also a good position if you had a C-section or episiotomy and when you're tired but still able to stay awake. You lie on your side and you face your baby towards your breast, supporting him or her with the lower hand. With your upper hand, you grasp your breast and you touch with your nipple the baby's lips. Once the baby latches on, use one arm to support your own head and the other to help support the baby's body and bring him or her closer to you. Is the baby getting enough milk? Your baby is feeding adequately when there is a swallowing sound heard as a k. During feedings, your breast is getting softer. After feedings, your baby remains quietly awake or goes to sleep for at least an hour. By day 4, the baby has at least 6 wet diapers and at least 4 stools. And of course, the baby is gaining weight. What should the mother eat while breastfeeding? Women who breastfeed need an additional 500 calories a day during the first 6 months, from which 330 calories come from the diet and 170 come from fat stores. During the next 6 months, an intake of 400 calories is needed. You should eat 2 cups of fruits, 3 cups of vegetables, 3 to 7 ounces of whole grains, 6 ounces of protein, 3 cups of dairy, and 6 teaspoons of unsaturated fat. Your diet should be rich in calcium, such as dairy, broccoli, tofu, and kale. It should also be rich in iron, such as beef, seafood, dried beans, etc. You should also be eating vitamin C-rich foods, such as potato, cauliflower, cabbage, etc. You should avoid allergenic foods, alcohol, over-the-counter drugs without consulting your physician, restrict your caffeine, and avoid smoking. Here is a table from mypyramid.gov that shows in a little more detail how many grains, vegetables, fruits, milk, protein, and oils you need during the time you're breastfeeding. What are common breast problems? How can they be prevented and treated? Flat and inverted nipples. If the nipples are flat and inverted, the baby won't be able to draw the nipple into the mouth. You can manage this by rolling the nipple between your thumb and forefinger just before breastfeeding, or by using a breast pump a few minutes before feeding your baby. Nipple pain. If your baby is not latching on properly, your nipples may get sore, cracked, or even bleed. You can prevent this by making sure the baby's mouth is open wide and is taking as much areola as possible. You can vary the breastfeeding positions to change the areas of pressure on the nipple. Wash your breasts and nipples only with clean water. Do not use any soap on your nipples because that will make them dry. Instead, you can cool your nipples with breast milk after feedings and let them air dry. This will keep them moist. However, if you do have nipple pain, you can manage this by using warm water before and between each feeding. Massage the breast before and during each feeding. This will make the milk flow out easier. Begin each feeding with the less sore side first, because this stimulates the milk ejection reflex, and the milk will flow out easier from the sore side. Use breast creams such as lanolin or hydrogel. And finally, talk to your doctor if all of these steps don't help. Engorgement. When your breasts are full of milk, they can feel full, hard, and tender. You can prevent this by breastfeeding every 2 to 3 hours and by avoiding using formula to supplement feedings. However, if you do have engorgement, you may manage this by applying warm compresses or taking a warm shower and gently massaging your breast before breastfeeding. This will make the milk flow out easier. If the baby has a hard time latching on, you can express a little milk with your hand or a breast pump, just enough to soften them. After breastfeeding, use cold compresses to ease down the swelling. Wear a well-fitting bra for support. Blocked milk duct. If a duct gets clogged with unused milk, a hard knot will form in that breast. It may be caused by missed feedings or constricting bra. You can manage this by massaging the area starting behind the sore spot. You can do this by encircling your fingers around your breast and gently sliding them towards the nipple, or using your fingertips in a circular motion, such as the picture shows. Then, use warm compresses on the affected area. Finally, wear a well-fitting bra without an underwire. Mastitis. It is an infection of the breast that usually occurs in one side. You will notice a lump on the breast and a hard tender area, accompanied by flu-like symptoms initially, which later progress to a fever of 102.2 degrees Fahrenheit. The breast may feel warm or hot to touch and appear pink or red. You can prevent this by positioning the infant correctly, avoiding nipple trauma and milk stasis, nursing every 2 to 3 hours and avoiding formula supplements, changing your nursing pads as soon as they get wet, and avoid continuous pressure on the breast from tight bras or infant carriers. If you did get mastitis, you can manage this by antibiotic therapy for 10 to 14 days. And you need to continue emptying your breasts by breastfeeding or using a breast pump, and finally applying warm compresses. Thank you for watching, and if you're interested to learn more about breastfeeding, in the description box below we provide a link for a guide provided by the Department of Human Health and Services. It is worth checking out.